Hi, my name is Dr. Andrea Shanowski, and I'm here today with AlignLife. I'm really excited because we're going to be talking about pregnancy and back pain today. There's so many women that are pregnant and dealing with back pain, and they have no idea where to turn to. A lot of times when we go to our obstetrician or even a midwife, they will tell us some different techniques with stretching and things like that that we can do at home to help with the pain. Sometimes even prescribing medications that can cause harm to ourselves, our baby, and even risk the pregnancy or risk our health in the process. So really today I'm excited because chiropractic is a natural treatment that can help not only to reduce your pain but also improving the function of your body so baby can grow easier, and it's also going to allow to have shorter labor times and even reduce your risk of a breech birth as well. So when we look at our spine, and I've got a spine right here to show you a little bit more about it, as we look at our spine, when we're pregnant, we're going to have an increase in hormones. And those hormones can actually cause our joints to be a little bit more lax. So there's a little bit more play in the joints that are going to allow for them to be a little bit more mobile for the birth process. Now in the pelvis, what that means is that instead of having a pelvis that's nice and stable for our spine, it can actually cause things to shift forward and backward and pinch some of these nerves that exit on each side of the spine and also in the lower back. And these are the nerves that go down to our toes, they go to our organs, they go to our uterus. So when those nerves are getting pinched, it can cause not only that pain, but also affect how our body functions and even cause pain that shoots down to the buttocks or into the leg as well. So it's really important when I find a pregnant woman that's coming into my office that I check everything going on with her posture, with what's going on with her spine. Because if we have some of those bones that are misaligned or we have joints that are way too mobile, that can cause some issues with the pain and the pressure. So now with pregnancy specifically, there's a lot of things that change as you grow and baby grows. What can happen is we can see increases in curvature. So instead of being nice and relaxed like this, that curvature can increase as our posture alters. We're also going to have a lot more weight on those joints. So if they're already weak and you've had a previous history of back pain or back issues, they can get a lot worse during pregnancy. Now with chiropractic care, what we do is make sure that those joints are in alignment, which is going to help to keep those tissues nice and structured so they're getting an even amount of pressure, not more on one side. The other thing we're going to do is make sure that your pelvis, this nice little opening here, which is where baby goes through, we're going to make sure that this is nice and open so that baby can pass through during the labor nice and easily. Some newer studies about chiropractic and pregnancy have actually shown that not only does it reduce your labor time with new mothers about 1/3 of the time, but it's also going to help with mothers that are going to vaginal birth after C-section, as well as mothers that are repeats, where they've already had 1 or 2 children at home as well. And one big thing that we can do as we're adjusting the pelvis, because that uterus attaches, it's got ligaments that hold it in place on our spine, our pelvis, and our sacrum. If we can adjust the pelvis and keep the spine in alignment, it's going to make sure that that uterus is able to suspend nice and freely. We're not going to have any twisting that can cause issues not only with pain in the abdomen, but also causing issues so baby is unable to turn over and actually is in a breech position for the birth, which can result in cesareans as well as some other changes, surgeries, and risk factors for baby too. So very important that we check our spine, make sure it's working well, make sure we have everything we need for pregnancy. So again, this is Dr. Andrea Shanowski, a family expert here at AlignLife. Please give our office a call if you wanted to have an appointment to check to see if you might be having some issues in your spine causing some of your pregnancy back pain. Thank you.